It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it is Friday. Of course it's Friday. We come at you live every Friday from the Money Radio Studios right here in the Scottsdale Airpark. And we're coming at you live here on Memorial Day weekend Friday, May the 24th. And I want to wish everyone a safe and happy Memorial Day weekend. Be safe out there if you're driving, and be safe there throughout the weekend, and a happy Memorial Day to you. If this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. And how do we do this? We do this by bringing extraordinary guests to the show, and today's no different. And I look across from me, I have a guest here on the show that is actually a colleague of mine. She is in the home care space, and she's making a really incredible name, not only for herself, but her company. And I want to welcome Sara Wilson, the Chief Executive Officer of Home Assist Health, to the studio.
Thank you, Bob. I'm glad to be here.
Well, it's good to have you. And, I don't often have one of my colleagues here on the show. We're always talking about other things relative to healthcare. I don't, necessarily, talk enough about the work that we do together. And it's interesting because we are partners in trying to deliver extraordinary care to our community and helping people age successfully in place. And it's not an easy task to do, is it?
No, and I appreciate you wanting to take the time to discuss home care. I do agree with you that it is often a hidden space of care. In fact, the Veterans Association has given it a label of the hidden heroes, and I think it's very appropriate. There's not enough discussion around the value of home care. So I appreciate you taking the time today.
No problem. No problem at all. Hidden heroes, and I always talk about the family caregivers who really are the unsung heroes. They're the ones that are making differences in people's lives every single day. And I think one of the things that's extraordinary that we talk about on the show, and we need to continue to talk about it, is some of the social determinants that many in our community have. And one of the challenges we have is we have so many that are living home alone. The count is roughly about 1/3 of our population, 65 and older, is living alone. And we know that that number is going to grow. Some predict by 2030 that number is going to be close to 50%. And in places like Washington, D.C., and Atlanta, Georgia, and San Francisco, and up in north in Portland and Seattle, it's 45, 46, 47% already. So we have some challenges that are ahead of us. And, this home care space is one that is relatively new. It's only about 30 years old. And people often lump us with home health, and we're very different from home health, aren't we?
Yes, and I'm going to take a minute to just back up with what you said. Home care was established approximately 30 years ago as a solution for our seniors and our disabled populations to remain at home and receive care at home. And it is been proven a quality choice for those individuals who chose home. And in fact, it also provides significant cost savings to our healthcare system. For every patient that is receiving care at home, there is approximately $40,000 in savings to the healthcare system. So we know it is a good solution. We know home care has to modernize. You had mentioned the declining family support ratio. That is a very real issue for home care. We also have to recognize the labor shortage across the home care space, in addition to the declining family support. So we have to modernize home care to fill in that gap. Home care is a service delivered by people, not necessarily by widgets or gadgets. So we have to modernize the role of home care in order to continue the purpose that home care was here to provide.
You unpacked a lot right there. I mean, we could take each piece and part and talk about that. I think one of the things that I really would like to talk about right now, I think, is the workforce shortage. I mean, we are challenged with a workforce that is shrinking and the need is growing. So the need continues to grow, the supply continues to shrink, and we have to get smarter about finding resources to be able to enable those that want to stay at home, which we know 9 out of 10 want to be able to stay at home.
Right. And when we talk about workforce shortage, we have to start with just recognizing that there's a labor shortage across every industry. This isn't touch home care alone. So when you recognize that fact, you kind of put it on the table, and then you have to look at what is the issue with home care and how can home care establish a solution. Being such a young industry, approximately 30 years young, we are still somewhat young in our infrastructure. We have a fragmented certification curriculum. Every state runs slightly different. So if you're coming from another state, it can be confusing how to enter caregiving, your certification criteria. Even the terms for caregiving vary based on your service delivery. I think there needs to start with just improving the infrastructure around the employment model for home care, and then you can start attracting and inspiring a workforce to choose it. And then you also have to look at how do you innovate home care so that it sustains the future of the demand.
And you talk about choosing it. And I think, part of what we need to do collectively is we need to educate consumers and people in our community how rewarding it is to be a caregiver. Because, we are, with wage increases, and especially with Proposition 206 taking minimum wage from $8.05 to $11, which will be $12 come January 1st, 2020, we are competing for similar labor forces that retailers, fast food, wholesale, companies like Amazon are competing for. We need to do a better job of explaining the fact that this isn't all about wiping butts. It's about helping your fellow brother and sister be able to age in place and how rewarding that is. We've got a tall order ahead of us, but I think that's something that we need to overcome because people don't see caregiving as such a rewarding experience.
I agree, and it goes back to that hidden hero concept is home care professionals, be it the direct care worker. And actually, as I say that, if I may, Bob, can I break down the definition or terms around caregivers?
Please do. Absolutely.
So caregivers capture several different spaces of professionalism. Oftentimes you see caregiver, and that's attributed to a family member providing care to a loved one. Then you might have in the state of Arizona, a direct care worker. That's often a caregiver that might be providing services under the Arizona long-term care program for our elderly and physically disabled population. Then you also have the label of direct support professional, which is again a caregiver but providing services under the Arizona long-term care system for the Division of Developmental Disabilities. And then you have the national label, which is often used as home health aide, and in Arizona, often applied into your facilities. So you have all our caregivers, but you have this varying term, and each term often has its own set of certifications required. So I just wanted to put that out there because there's a very real opportunity that I know that the home care space is actively engaging on to improve and creating more uniformity around the role of the caregiver. With that said, the value of the caregiver across all these terminologies is incredibly meaningful. Caregivers, however you label them, are critical and essential in assisting people with disabilities and seniors in completing tasks essential for daily living and remaining home safely. Caregivers also perform in a critical healthcare role. They are often the first to identify changes in conditions and behavior. They assist in reporting those to medical professionals so that those medical professionals can adjust diagnoses and treatments to be more effective. And then there's respite care. Caregivers provide relief to the primary loved ones so that they can take a break and take care of other things. So home care provides a meaningful and substantial value to the overall population in the healthcare system.
I so appreciate you walking us down that ladder and really helping us understand the various names that many of the entities that we serve describe them. Whether it be our Arizona Long-Term Care Service side or our developmentally disabled side, all are caregivers. And the interesting thing is, before we even began this conversation, I talked about the difference between home health and home care. Real simple. Home health is medically driven. It's episodic driven. It's usually a nurse. It's an occupational physical therapist or speech therapist. Home care is a caregiver that is providing non-medical skills, helping someone with their activities of daily living, which is getting dressed, going to the bathroom, preparing meals, eating meals, taking their medications. And as you can hear, we have Jerry Rafferty taking us out. So we're down one segment, Sarah. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Sara Wilson in the studio. She's from Home Assist Health. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. And if you're just tuning in, we're on our second segment. And I've got Sara Wilson from Home Assist Health. She's the CEO over there. And in our first segment, if you missed it, you can catch it up on our website at cypresshomecare.com. Click on the media button. The third button down is radio show. You'll catch that first segment. You'll catch about 300 others that we've been bringing to you for the past 6 years. So in that first segment, we talked about caregiving. We talked about the differences in the various silos, if you would, in our local government, with the Arizona Long-Term Care Service, with the Arizona Division of Developmentally Disabilities. Did I say that right?
Yes.
There's so many different names for caregivers, but we all do the same thing. We're providing nurturing, non-medical, in-home care services, helping our aging population with activities of daily living, and those are helping bathing, showering, going to the bathroom, meal prep, and making sure they take their medications. In some cases, we're driving them to appointments. We're doing that social interaction and helping them maintain their existence inside their home. As Sarah pointed out, if they're not able to stay at home, they go into a skilled nursing facility, assisted living facility that can cost up to $40,000 more than being at home. So very interesting, and I conclude the first segment talking about the difference between home health and home care. And home health is very different. It's more episodic driven. It's more medically driven by nurses, CNAs, therapists, and they're doing either wound care, they're doing physical therapy, they're administering medications, and all of those things we don't do in the in-home care business.
And to follow up with that, Bob, when we look at home care, and you described it perfectly, it is the non-medical service delivery. And to depict that further, you would see home care almost like your second set of hands, your eyes, your ears, your feet, to go around your home, to go into the community safely, and to navigate the challenges of your life as you encounter new diagnoses and complications with aging. And so the home care looks almost like an extension of your family. And it could be doing tasks such as self-care, grooming, meal preparation, light housekeeping, assistance with appointments, transportation. It captures a very comprehensive component to your home health needs. And as you described home health, it's very episodic and specific, where home care is much more comprehensive and complete lifestyle.
I often say that our caregivers, including yours as well, anyone that's providing care, we're more like surrogate sons and daughters. We're that family member that can't be there. You know, the home care study that was done about 4 years ago that the Home Care Association of America published, they tell us that the closest adult child to a parent is approximately 280 miles. And, you know, it's so different in the last generation. I can remember my grandmother caring for her mother. She cared for her husband. She cared for her brother. I mean, the nuclear family was together. I mean, they lived on the same street. And now, you know, especially in our market here in Arizona, you know, this is such a destination. And I know that you're from here, but there's so many that aren't, that come here because of the climate and the better quality of life, but their children aren't here. So somebody's got to help them. And I look at my caregivers, and I know you feel the same way, as kind of their surrogate sons and daughters when their sons and daughters can't be there. So, got a question for you.
Yes.
How'd you get into this business?
Good question. I wish the answer was much quicker. Home care was more of a calling for me. I did grow up in a household where both my parents were in this space. My mother did a lot of work in the area of senior care in Sun City, and my father was working in the area of the Division of Developmental Disabilities for the state of Arizona. And they both were very active in their jobs, and at one point they looked at themselves and decided, how could we make a more meaningful difference? And they decided to open up their own home care operation. And that was a long time ago. I was very young. But I do believe that some of their decisions really influenced me later in life. When I first graduated from my undergraduate degree, I wanted nothing to do with the same career path as my parents. I wanted to chart my own course, and I went into different, more private corporate America. And after about 3 years, I didn't feel a self of fulfillment. I almost likened myself as a cog in a wheel, easily replaced with my efforts not having a meaningful outcome. So there was an opportunity for me to get engaged with a grant. It was a CMS New Freedom Initiative grant that the state of Arizona was partnering in, and it was a project manager role. I jumped in and took on that project, and I fell in love with home care all by myself. But I do think that I was definitely influenced by the role of my parents played for me as a child.
You know, you said something that clearly resonates with me as well. I feel like it's a calling. Mm-hmm. You know, there's so many people that I know, and I know you know as well, that have chosen careers that they're jobs. It's 8 to 5. And, you know, they come home and they're so done with work. I mean, unfortunately, our business isn't 8 to 5. Kind of sometimes wish it was, but I know it's not, because this is what we need to do. So, I mean, I feel like, you know, it is a calling. I feel like a servant of my community, our community, and really helping and navigating for these families that we serve to the solutions that they need for their loved ones.
I agree. And when I look at my career path, it was, if I'm going to spend majority of my time away from my immediate family, then I want to focus on how can I feel like that was worth my time. It was worth my time to be away from my family because I helped improve somebody else's life, somebody else's family network. And when you talked about the growing space between family members, you're really touching on the top of the iceberg when we look at the changing demographic of not just Arizona, but the country. We're really splintering off as a family. And as we have fewer people entering the workforce, as we do entering the need for home care, our demographic space is changing. And we have to consider, how do we help improve our population's health, our seniors' security and safety in the home? And we look at the risk to our healthcare system. I really believe that people are the solution. And we're in the people business. Home care is the people business. And I am a believer that we're in this space not just because we want to help one person's life, but to help many by using people to solve bigger problems.
I think that's an incredible segue going into our halftime. It's hard to believe we're at halftime. Goes by fast, Sarah. I told you it would.
It goes fast.
But I will tell you, in the second half, I want to talk about how we innovate and how we look to the future of home care. Because we know the challenges that we're dealing with today, and we can sit here and complain all we want about those, but we need to be innovative. We need to step outside the box because we know we have an aging demographic. We know that 10,000 people a day are turning 65 and older. So stick around. There'll be a whole lot more. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Sara Wilson in the studio. She's the CEO from Home Assist Health. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we are coming at you live from the Scottsdale Air Park. It is the Friday before Memorial Day weekend, and I am pleased and lucky to have Sara Wilson, who is the CEO of Home Assist Health. She's one of my colleagues in the home care space, here to join me today. It's hard to believe we're in our second half, but if you missed the first half, you can catch it right up on our website at cypresshomecare.com. Click on the media button. Third button down is radio show. So in our first half, we talked a lot about home care, and we talked about really defining the work that we do and really how it came to be. We talked about the differences between home health and home care. And when we left off on the first half, we talked about the future. And the future seems a little daunting. It really is scary. We know in Arizona, and this is information we've gotten from the Paraprofessional Healthcare Institute. They are an organization out of New York, been around since 1991. They've been tracking for almost 20 years this direct care workforce. We know that between 2019 and 2026, we're going to need 62,000 more direct care workers to care for our workers in our space, or I'm sorry, for our community, for our older adults in our space. But we also know that we're going to lose about 30,000 to retirement and to pursuing other careers. So the number truly is about 92,000. And when we also left off, we talked about how we need to innovate and how we need to differentiate. And, you know, Sarah, I admire you. I admire you in so many ways because we can all sit here and we can say, hey, you know what? Woe is me. We're going to just do the best we can. But you're doing some of this, stepping outside of the box right now. I know that you're doing some pilot testing. I know you probably can't go into some of the details here today in terms of who you're doing it with, but let's talk a little about how we can innovate home care and deliver home care differently today, but more importantly, tomorrow.
Yes, and you hit it perfectly. There has to be a response to the changing demographic. There's no way to meet the growing demand with the current workforce supply and the future workforce supply. So we have to look at the model of care. And when we look at the model of care, there's some very easy reach, almost common sense solutions. And they range. So one is technology. There's more and more work being done in the space of technology, such as smart home devices, Bluetooth devices. There's more that can be used today to help secure and stabilize an individual who wants to receive care or age in place. There's also a movement to improve information integration from social services to healthcare professionals, which also helps streamline service programs. What I really enjoyed watching evolve is the bridge connecting health to home and the opportunity for the home care space to help fill that need and perform as that bridge. And that's where Home Assist Health has come in to pilot some ideas. And the ideas we've piloted, we're seeing work. So to give a simple high-level description, we are working with partners, physician partners, even long-term care partners. If there is a patient that is determined to be at risk based on social determinant of health factors, also referenced as socioeconomic factors. These could be individuals living alone, or they might have a combination of complex health diagnoses, varying factors, also economic, transportation. If they have been determined on a risk scale to be at risk, and those risk factors can compromise their health and safety at home, then we will go in and perform a non-medical home care assessment and intervention to stabilize those social determinants of health risk factors for improved health outcomes. So that's essentially our idea, and so far we've seen it work. It's a very small footprint so far. We want to keep it small as we're piloting it to make sure we get all the infrastructure and the components correct. But we're excited about it because it does provide a greater value to the home care space and more meaningful outcomes for the healthcare partners.
Absolutely. I mean, it's funny because, a colleague of mine, I used to serve on the board for the Private Duty Home Care Association, which is an affiliate of NAC, the National Association of Home Care and Hospice. He talks about how we are on the edge of a crisis. We are not prepared for what is coming. Our concern is that the demand is going to outstrip supply unless we see a dynamic change occur. And that's Bill Dombey, President and CEO of NAC. He's so right. And knowing this, I love the fact that you are stepping outside that box, stepping outside the comfort zone, and really looking to innovate and change. When you really sit down and you think about it, you take someone from an acute, which is a hospital setting, or post-acute, which is a rehab or skilled nursing facility, and bring them home. That transition of that care is so critical. It can be the first 24 hours. It could be the first 72 hours to make it a success. And I love that you're measuring the social determinants of health, which can be a number of different things. Like you said, complex health conditions, could be socioeconomic status, could be living home alone. And how do we make that safety or that transfer as safe as possible?
Correct. And as we've seen, many of these patients need just simple assistance so that they can be more healthful in their habits. For example, an individual that might go home with a brand new diagnosis or be a new amputee due to complications of a diabetes may not know how to navigate that life for them anymore. And with the support of home care, not only can we go in there and help them navigate that life, but help them master those new habits. We know habits take many times of practice before they become a habit. So what we're doing is we're using principles that have been practiced and proven through habilitation that is under the Division of Developmental Disabilities long-term care program and applying it to this higher risk population. And this higher risk population can be somebody just with complications of aging. And you've seen habilitation in different states be used for people with Alzheimer's and dementia. And we also know that habilitation has been used successfully for children with autism, and it's advanced to have baccalaureate and master's programs in applied behavioral analytics. So we're taking the same framework for a concept that's been proven in these other patient profile types and applying it to our seniors and to our at-risk population in the greater community to help stabilize their health so that hopefully they don't need to be using our healthcare system as much and they have a better quality and higher safety at home.
You said something in the first segment. We're in the people business. We care for people. We're in the people business. Habits take time. It's not something we can just turn a switch and, like you said, give a diagnosis of diabetes, give a diagnosis of, congestive heart failure, whatever that diagnosis is. I mean, there has to be a life change. And part of that is wanting the consumer or the patient that we're caring for, wanting that change. But the other part is people need to help them and assist them through that so that they can make that change. Sometimes they can't do it alone.
And it's very difficult to do it on their own if they can. And with a lot of mistakes sometimes and errors, we also know that depression is a growing epidemic, and individuals that are on home care have lower reported rates of depression. So you're right. We're in the people business, and sometimes people are the best cure. And so we're trying to do that.
Well, and one part that I want to just leave off on this third segment is medications. And, especially those that are transitioning from that hospital or SNF, that skilled nursing facility back home, and they've gotten these new medications, and they were on medications prior to, and it's making sure they're taking the medication in the right dose at the right time. And even though we are not clinical, we are there to help them make that choice. You see a lot of that, don't you?
Very much. And it can be very complicated for anybody, let alone somebody who's challenged with memory loss, dementia, Alzheimer's, or other complicated factors.
And then the other complication, too, is those that are, drinking alcohol. We talk about that a lot here on our show. I mean, the complications that come along with that. And then the risk of falls, which can set them completely back or never allow them to come back home.
Right.
Well, I got to tell you, our engineer, Wes, is doing a really good job. He opened up our segment with Hungry Heart by Bruce Springsteen, and he is ending our segment with a little more Bruce Springsteen. So it must be the Boss Day. The Boss Day going right into Memorial Day weekend. We're down our third segment. Sara Wilson, we got one more to go. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, I've got Sara Wilson from Home Assist Health. It is Memorial Day Friday, and we are going into the weekend. We certainly are entering in with a great song by Loverboy, Working for the Weekend, and a little cowbell to start us off. Happy Memorial Day to everybody, and I wanted to jump right back in with you, Sara. We're talking home care. And if you missed our first three segments, go up to the website, cypresshomecare.com, click on the media button. Third button down is radio show, and you can catch the first three segments and about 300 others that we've been bringing to you for the last 6 years. So we left off really talking about home care. We've talked about a number of different things that home care is all about, the various types of home care, why home care makes sense, because it saves a lot of money for not only families, it saves a lot of money for our state government and our federal government. But I wanted really to, leave with this last segment talking about how do you access home care?
Great question, and I don't think there's enough knowledge in our general community about how to access home care. Home care has a couple different options to our community members. Some go private pay, which is basically out-of-pocket payer to a home care provider. You also have an Arizona long-term care program through Access. So there are some eligibility requirements, such as what is your income level, and what is your diagnosis type, and what is your level or aptitude of activities for daily living. And those are determinants for whether you're eligible for an Arizona long-term care benefit. And then you also have the third option, which would be a private insurance for long-term care services.
So those are the options, and I want our listeners to know that if you have any questions, obviously we give out our phone number regularly here on our show, but I want to give out Sara's number. You can reach Home Assist Health at 602-795-7620 or go to homeassisthealth.com. Their website is very robust, and you can navigate through there and you could find some solutions that you may be looking for.
And we do have in-house an expert, Arizona Long-Term Care, an application guru. So she's very active in our community and helps many people with the LTEX application process. And so if anybody does have questions, we are happy to assist them with that. And I want to take a quick moment also to take a moment to also go through a definition practice for people who are receiving care. Just like the caregiver has many different labels, so does the person who receives care. So just to take a minute to define that, as it can be confusing when you're entering the space. You have a patient who's a recipient for home health or a healthcare medical-based program. You have a member who is a recipient of Arizona Long-Term Care insurance benefits. So that would be a member. Then you have a client, and that's typically going to be somebody receiving services through out-of-pocket private duty programs. So all of them are the same, but they're defined based on their payer type.
Right. And it gets very confusing. And I know in our space, I mean, I'm a provider for Arizona Long-Term Care Services as well as private pay, so it's either a member or client, and I feel like that's the same for you as well. But those that are receiving medical care, they're patients.
Correct.
So there are lots of labels that can be put on them. So as we get ready to wind down our show, I really want our audience to feel optimistic about the future of home care. The industry, as we shared in the first segment, is about 30 years new. I also shared how we get lumped in with home health. And if you're listening in and you have a loved one or you're experiencing or you know somebody that is in a long-term care facility or in a SNF, skilled nursing facility, or in a hospital and getting discharged, if they need some assistance with activities of daily living, and activities of daily living is the ability to be able to maintain their independence. And that is getting dressed, that is going to the bathroom, that is showering, that is reminding them about medications and meal preparation, transportation, all of the above, those things that are not medically related. Home care is what you need. You need somebody to help that individual. I always say family first. If family's not available, friends or neighbors. And when you strike out with those three, then you need to look to employer-based agencies like Home Assist Health or Cypress HomeCare, not independent contractors, not registries that engage independent contractors or private caregivers. I think many have read the horror stories, the horribles that are in the media about those things that happen to our vulnerable population when some of those individuals that have not been background checked, they have not been trained properly to administer or provide home care services.
I'm glad you said that. And to just end on that note you mentioned, it's almost as if you're going to contract out for a project on your home, they tell you to hire somebody or employ somebody who's been licensed and bonded so that you have safe service. It's a very similar concept. When you go to an employer model, you're ensured that you have a workforce that has the necessary insurance supporting you and supporting them, and that they've had the necessary trainings to do the services properly and safely.
And then the other part is really, managing the care coordination piece. Because the great thing about Home Assist Health and Cypress HomeCare and others out there, there may be a chance that caregiver might not be able to show up that day. Could be sick. One of the kids could be sick. Could have had an automobile accident. But the great thing about companies like ours is we have caregivers to back them up. So when that person can't be there, someone else will be there. Because when Mrs. Smith or Mr. Jones is getting up in the morning and needs that assistance, he or she cannot go without it. And if you have an independent caregiver there or a contractor and they don't show up, they don't show up. So very, very important. As we get ready to wind down, I would love for you to leave our listening audience as we go into the Memorial Day weekend with just some thoughts to think about home care and why home care makes sense for them. I know I'm putting you on the spot, Sarah, so we've got probably another minute or so to wind down. So I wanted just to make sure we leave just some remarks that our listeners can take with them as they enter into the Memorial Day weekend.
Thank you for that transition and putting me on the spot for final notes. I would want everybody to be left with the knowledge that home care is a meaningful and very important value contributor to our state and our country. Home care is so pivotal in helping secure the lives of our aging and our disabled population. And home care has so many different ways it can help us as individuals. And we need to listen. We need to seek more information. I encourage everybody who thinks they may be interested in learning more about home care, or they may have a loved one in need of home care, to ask for information. Contact Cypress, contact Home Assist Health, and we'll help you.
And the last thing I want to leave is if you know a caring spirit, or you are that person, and you want to make a difference in somebody's life. We talk about a shrinking caregiver pool. It is an incredibly rewarding experience to help somebody age successfully in place. The people that we care for have amazing stories and have lived incredible lives. And it's amazing how much I've learned from our clients. I know that you too have learned a lot from our clients. So if you are looking to maybe make a career change, or you know somebody that wants to get into the caregiving space, call Cypress Home Care at 602-264-8009 or call Home Assist Health at 602-795-7620. Sara Wilson, thank you.
Thank you.
We got so much more that we can talk about. I definitely would love to have you back on the show. You've been listening to Health Futures, Taking Stock in You. Happy Memorial Day weekend. Sara Wilson, thank you for being on today.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.